More than 400,000 Americans are treated for burns every year in emergency rooms, according to the CDC. So what's happening to your skin when you get burned? Our Dr. Darien Sutton is using some VR technology to show what's going on underneath the skin when you get a burn. Take a look.
Burn injuries are a common reason patients come to the emergency room requiring and needing assistance. But in order to understand burn injuries, we have to understand the anatomy of the skin. We have a cross-section of the skin in front of us. Remember, the skin is the largest organ in the human body, and what makes it complex is how it's layered. We have our top layer here, the epidermis. That's a layer that doesn't have any blood vessels roaming through it. As you can see, that's where the hair follicles break through, and this is the layer that often and constantly remakes itself. A burn to this area is most often mild. We qualify that as a first-degree burn, and the most common type of first-degree burn is a sunburn. Below that is the dermis, and as you can see, it gets quite complex. There's blood vessels roaming through it, even nerve endings, the base of hair follicles, and even sweat glands. And a burn to this area will be qualified as a partial thickness or second-degree burn. This burn can present with significant blisters that can be quite painful. And below that, the third layer is the subcutaneous layer. This is the deepest layer of our skin. This has our fat, which is highlighted here in yellow, as well as blood vessels roaming through it. And if a burn were to get through all three of these layers, it would be called a full thickness burn. Now, these are the types of burns that often require critical care, ICU attention, and often are transferred to burn units. And these are the burns that can be disfiguring and life-altering. Now that you understand the layers of the skin, you understand the different types of burns, which ones are more severe than others, and why that is.
And Dr. Sutton is here now to break this down a little further for us. That's real? All of that is going on underneath here?
All of that is going on in the largest organ in your body, your skin. So I think it's so helpful sometimes to just understand what it looks like.
This technology is so fascinating to me. Is it fascinating to you too, or are you just like, well, yeah, duh?
Well, at first I'll be honest. At first I pick up this VR technology and I say, well, this is what I'd expect to see. But then when I'm listening to the people behind the camera, I'm really quickly realizing how helpful this information can be to a topic that we always talk about.
Yeah, we are not doctors. We have not seen this before. That's a lot of new information right there. So in terms of burns, what's your advice when you experience one? Because not everything requires medical care, right? So you talked about the degrees there. How do you know just by your own experience whether or not you need to get more help?
Yeah, well, a burn, what we look at in the emergency room, we're trying to understand, number one, where is it? If it's in specific sensitive places, for example, the hands, the eyes, the feet, even in their private areas in your genitals, those are areas, of course, you want to make sure that you talk to a provider about, regardless of whether or not it's large or small. And then we look at the size. How much of the body is encompassed with this burn? So important for kids. If you think about it, their skin to body ratio is a lot higher. Children, unfortunately, can suffer a lot more from burns than adults. So it's so important to talk to a doctor regardless of the size on a child. And then the depth. And that's where this VR technology comes in handy, because this is a description that I'm trying to help patients understand the differences between first, second, and third degree burns. I realize often that goes over people's heads up until I can pull out a virtual reality depiction of what your skin really looks like.
I'm still fascinated just looking at it. So obviously, number one concern when you have a burn is function, right?
Yes.
I want to be able to move my hands the way they used to, et cetera.
Yes.
Second concern is then scarring.
Yes.
Can early medical intervention help with that?
It can decrease the scarring, but what I always tell patients, unfortunately, is that once you develop that scar, inevitably that scar is some way going to be permanent. Our goal at that point is making sure that we can reduce it as much as possible and make sure that it's aesthetically pleasing. But beyond the risk of scarring and function, we also care a lot about infection. Your skin is responsible for protecting you against all those germs. And so when you get these burns, as a physician, as an emergency physician, my number one fear is dangerous infections, which is why it's so important to keep these areas clean, dry, and covered.
And I'm putting you on the spot here, but I want to do a little myth busting, because I've always heard you're supposed to run a burn under like lukewarm water or cold, chilly water, but not cold, because if you don't, it can continue burning. Is that true?
Well, the goal of running it under cold water is correct, but it doesn't necessarily stop it from progressing. What it can stop is it can stop the inflammatory changes that occur, which unfortunately can be associated with what we find after a burn has been completed. So that idea of running it under cold water is, number one, to help eliminate some of those pathogens and germs and to stop the progression of inflammation, and hopefully give you a little bit of time so that you can get to your provider and get the appropriate treatment.
All right, Dr. Sutton, thank you. Thanks for the awesome technology lesson.
I'll be back with more.
And thanks for answering my on-the-spot TikTok medical questions. Much appreciated. Thank you.
Of course.
And thank you for watching. I'm Diane Macedo. The news never stops, and neither do we. And get ready to shop this afternoon. Our friends have some deals in today's Secret Savings lunch break, and we have a lot more news for you right after this.